Dr. Paul here. I heard I've got a young one with a rash. Not sure what we're gonna go see, but let's go take a look.
First, she had a fever and a head cold yesterday.
Okay.
And then this morning when she woke up, she seemed normal,
Okay.
congested. And then after a few hours, she started getting a rash on her lips and
Okay.
her cheek.
Yeah.
And then it migrated from there to her hands, to her elbow.
Okay.
And this evening we found a little bit starting to show up on her leg.
All right. So you've got a little rash. Does it seem to bother her?
It doesn't seem to bother her,
Okay. And is she eating okay, drinking okay?
She has less of an appetite than normal.
Okay.
She's usually a big eater.
Yeah. All right.
So hence the snacking
Yeah.
tonight. But she does seem to be drinking okay.
Okay. Super. Super. You've got nice shoes. Those are pretty shoes.
They're pretty nice.
Yeah, those are shoes. Let's see. Do you think I can wear those shoes? No, they're too small. They're too little. Let's put that one there. And you got, oh, nice socks. You got little birdies on there. Those are great socks. So I'm going to take a look under here. Oh, there's your toes. Let's see here. So, I'm not sure if that's a little rash there. We're starting to see little red spots appearing, I think, on your feet. And your hands, definitely. You've got these little almost raised little lesions on the hands. How about on this side? Yep. You're starting to see some little rashes on your hands. Huh. I wonder if you have any of those rashes in your mouth. Shall we take a look?
I don't
think that we should do last, because probably when I look in your mouth, you're gonna like go, nah. I gotta listen to your heart. Good job. These little spots that are on the hand, slightly raised. You happen to have a little murmur that's a normal one. I don't know if I've ever told you that before.
I think in her 1 year checkup you did say
those,
that.
ooh, ooh, ooh. It's musical. And it's another name for it is a functional murmur or Stills. Dr. Stills, way before I was born, I believe, named that murmur.
Huh.
What it is actually when the heart pumps, the left chamber is way larger than the right, more powerful because it has to pump to the whole body. So as that blood shoots around the aorta, the largest blood vessel in the body, it makes a little whoosh sound. Almost like vibration in a pipe. If you ever turn the water on, it goes brrr. Yeah, it's just vibration. It's a vibratory murmur. You got a nice little tummy tickle. You have any rash on your tummy? So we got a little bit of a faint rash on the legs. It's also on the arms a little bit.
Yeah.
Yep, on the cheeks. When I first walked in and I saw the rash around the mouth, flashed in my mind was impetigo, which can be staph or strep infection that's very common around the nose. But this is something else, which I think you've already kind of guessed with the fact that it involves the hands and the feet, and I suspect the mouth. Oh, wait a minute. This, folks, is hand, foot, and mouth disease. This is different than hoof and mouth disease that animals get. That's a whole different virus. I am going to check her mouth. I'm going to grab a tongue blade and just tip her back. Whee! There we go. Let's see that throat. All done. Hand, foot, and mouth. Being viral, you don't need any antibiotics. You want to make sure she's getting enough fluids so she doesn't get dehydrated. And really, fever is okay. Our body mounts a fever to help fight the viral infection. So I wouldn't necessarily lower the fever unless she's like crazy miserable, like 103, 104.
Okay.
Otherwise, I would just, lots of fluids and comfort. It lasts about a week, maybe 10 days at the most. It's fairly contagious, but most of us have had it.
Okay.
So if you are beyond 7 to 10 years old, it's pretty rare to get hand, foot, and mouth. You've probably already had it.
Okay.
I think most kids, I would say, get it in preschool. Super rare. I honestly have never seen this, but this group of viruses can cause like an encephalitis where you'd just be really out of it.
Oh, okay.
That would be the only time to come back is if she was like, can't drink fluids.
Okay.
But you'll be able to keep up with fluids. Now, sometimes, like I was almost fooled when I first walked in and I was thinking impetigo. That's a bacterial infection. It's rare, but if the skin is broken, we all have bacteria on our skin.
Mm-hmm.
It can get infected, and that would look like yellow crusting, and just you would tell.
Okay.
It'd be pretty harsh. Whereas these they just sort of go away.
Okay.
Yeah. All right.
Sounds good.
Wonderful. Well, thank you for letting us
Keep an eye
take
on
a
it.
good look at your rash and educating the whole world.
Yeah.
You might be the face of Hand, Foot, and Mouth. Famous.
I know, you've got a pretty classic hand.
Pretty classic. You got the hands and the foot stuff going on. Really good. All right. Thanks a lot.
Thank you.
Thanks for watching. This is a pretty typical case of hand, foot, and mouth. I'm sorry I didn't have a great look in the mouth, but I didn't want to upset our... I'm Dr. Paul. Thanks for watching.